Hi, What the HealthTech listeners. I'm your host this week, Rebecca Lindley. This is the podcast where we tackle some of the trending topics, best practice and ideas within health and social care. In this episode, we're wrapping up another successful season. Season 4 has come to an end and we've covered it all, from CQC insights and sustainability to the future of health and social care. So let's dive in.
The reason I think it's important to improve efficiencies is because the more we do that, the more time we have left over so that colleagues can do the really important work of engaging directly with the people we support. And often, because of the way in which the systems work, so we have regulation, which is very bureaucratic. We have things like commissioning managers who require different sets of information. And all these things take people away from the central role of delivering care. The more we can automate, the more we can develop systems, and also the more that the sector talks to people like you who are tech people, the more we'll have really bespoke systems that answer our needs. And one of the things that I've always been really interested by is that I often hear people say to me, oh, but that system doesn't do quite what I want it to. And I always say, well, talk to the people who develop that system, because I've yet to meet a techie who can't respond to whatever we want. So I think the communication between people who use systems and people who develop and deliver them is a really important part of the future and how we will get technology that works for us all.
There are lots of different technologies that people use to communicate with, but it never quite gets rid of the need for needing to actually understand that person and how they communicate. I think one of the crucial things from our digital care planning is that has all of that information about how that person communicates, and it manages to capture that experience of that person like we talked about earlier. And then I think the feedback collation tool that we created in Radar has enabled that triangulation that we talked about. So you're capturing all those different observations, you're capturing all the different ways that person does communicate, and what they are able to communicate with you about how they are enjoying their lives, feeling safe, etc., etc.
Yeah, absolutely. And I suppose one thing to note on that is like how far it's come. You know, we are talking like tech in the last 5 years that has really excelled within this area.
2024 has been such a successful year for Radar Healthcare. Can you share some of the highlights and key milestones that stand out?
I don't really know where to start because so much has happened in the last 18 months, but specifically this last year in terms of the kinds of customers who've joined Radar Healthcare, the kinds of work that we're doing, the kinds of rollouts we're doing. So there's so much to look at, and our breadth of customers now goes from independent private providers of clinical practices to small care home groups to ambulance companies, right through to some of the largest trusts in the country. One of our newest customers is London Ambulance Service. We've got Guy's and St Thomas Merseycare. We've got the biggest care groups in the country, the biggest private hospitals in the country, and then whole healthcare economies internationally. So I think it's been phenomenal really for Radar Healthcare to have that scale and breadth of growth across the whole of not just the UK and all the different sectors within the UK, but internationally too, to give us that absolute baseline to start to pivot and do some really cool things.
We use Radar for our patient safety events and risk management, but we also use it for managing complaints, but also compliments, which is really important from our perspective. So we look at trends in our complaints, but also in our compliments, because you will have heard of Never events, I'm sure. And, we obviously monitor for Never events within our organisation. But another term that's used sometimes in healthcare is always events. Mm-hmm. And I'm actually much more interested in always events, because from our patient's perspective, what should they always see from us as healthcare professionals, as teams who are caring for them in a hospital? And reviewing our compliments and thematically and analysing them means that you can determine what are those always events. Because what are the things that our patients want from us? And it possibly isn't the things that we think they want from us, because the things that are important to us sometimes are just expected by patients. For example, you come into hospital and you just expect your care to be safe.
Yeah.
Why would you not? So actually the patient's not focused on that. They're focused on other kind of value add type things from you. So I think AI is great, but I think it's got to have the human validation, because all those themes come out and then you look at it and go, oh yeah, actually, but that's there because of this.
Yeah.
And so you've got to have that human validation of it.
So I suppose going through this, you obviously have recently lived this experience. What kind of piece of advice would you give anyone that can help non-verbal individuals express their needs?
As a family member, I would certainly express the point to ask lots of questions. Don't be afraid to ask questions. Don't be afraid to ask what you think might be a really basic question, or ask the same question over and over again until it makes sense to you and people feel like they've got a handle on what it is. And things change when they become non-verbal. For us, in our experience, it was because he was fragile and frail, and at the end of life, and was in palliative care for a number of weeks. And so for us, it was about asking the questions and asking them again, just to sort of make sure that we understood them. I think for the care system, just don't assume that when you've answered a question that the person really gets it. They might still just need some support and some help. And so just being kind, giving us the time that it takes just to learn about the processes, the systems. Also, we weren't informed, but we're going through it now about continuous healthcare funding, CHC funding. So we are still able to apply for that to support Dad's care once he was released from hospital. I should say discharged from hospital, not released, but discharged from hospital, because understandably, there's only a small pocket of money. There's the NHS is what it is at the moment, but there is the ability to ask for funding, even if you don't think you're eligible. Just ask those questions as well. And carers are very good at saying whether you are eligible or not, and sort of start the ball rolling. So asking about funding just to support you and your loved one in that time is really imperative too.
We have a range of ages, within the sort of the workforce, and sometimes people can be afraid of technology. So I think, getting that feedback of keeping it simple, breaking down the tasks, it really, it just helps embed the system into practice. There would be nothing worse than having an amazing system, all singing, all dancing, but actually staff don't feel confident to use it. Because then that's just counterproductive of what we want to achieve.
Of course. And what advice would you give to other organisations who might be feeling apprehensive about the way new technology might be received by that front line of staff?
Yeah, I think it's about having that input. So with the radar system, creating the events, creating the audits, really think about the processes that you currently have, and also what do you capture now, what do you need to capture for external stakeholders, and so how can you make the system fit what you need it to do, but also think about what would you like this, what data or what information would you like to capture that you can't currently. And really think about how you're going to introduce that system into the team.
In terms of what you do to prepare, have confidence. The quality statements, the evidence categories, the 1 to 4 scoring are in place. Yes, you can see a tweaking around the edges and they're doing some work around what happens when they physically visit and write the reports, but those structures are in place. So make sure, if you aren't already, make sure you're using them with your evidence organisation and labelling. And I think the third thing that we really need to work on, feedback and staff prep. At the end of the day, we need to ensure that staff can confidently give an account. It's not about being word perfect, but it's about them feeling that what they say is a fair reflection, and making sure that those feedback processes, whether it's something that you do in partnership with us, whether it's something you do internally, you make sure those feedback processes are going well. Because at the end of the day, if you have the best processes and the best observation in the world, you could still get inadequate if all of those feedbacks are not in place. And as we've said earlier, we do know of at least 1 or 2 services who have been openly told the reason you didn't get an outstanding is because you didn't have the level of feedback we required. So doing that feedback piece well is central to gaining or maintaining that good and outstanding rating.
I think some people get hung up on having a digital strategy and having a really clear strategy as to what you need to do, and kind of, you're going to implement this system, then in the next budget you're going to do this system. Some people are not in that position, and they might be talking about a small care home group who don't have kind of a big central team who can organise all that, or you don't have an IT infrastructure team. So I'd say if you're a mature organisation and you can have a digital strategy, fantastic. It's a very similar kind of philosophy, even if you're big or small and you've got that team or not, to build a digital strategy. The main thing is to focus on what problems you're trying to solve. At the end of the day, you're trying to buy a system to either bring you efficiencies, bring you quality improvement, reduce risks around your paper-based processes or existing systems that you've got that are now outdated, or you're looking to innovate. So those are the kind of things that people buy digital systems for, and that's why it's important to kind of focus on what the problem you're trying to fix is and then find the solution for that. That might mean you're focusing on that kind of piece of work for a year, 2 years, 3 years, or that might be a 2-month piece of work and you're ready to move on to the next one. I think people focus on too much about what should we do in what order, and it's not always about that. It's just finding that biggest problem that you need to solve first.
Where it importantly helps individual healthcare professionals is, there's so many stories now where they can't actually access the training because they're just too busy. And they're now getting home exhausted and needing to do it in the evening, which means they can't access a simulation center if it's at home in the evening. And the last thing you want to do is suddenly be faced with a 64-page, highly intense document when you're exhausted. So if there's something that you can do where you can access at any time, it can allow you to consume the same content 4 times faster, but also it allows you to pick it up and to drop it off, so you can do 10 minutes here, then put it down for a while, then do another 10 minutes. This is where immersive technology can really help.
Can you tell us a little bit more about why sustainability matters within health and social care?
Yeah, so if you kind of think about it, health and social care is part of the planet. So people get poorly. So there was a girl that Southwark Council ruled a girl actually died of air pollution. So imagine there's somebody in a poor air quality zone, they're breathing that in, then they get more complex health needs, which is going to put an even more strain on health and social care providers. So if we can make the planet better, then we're in a nicer environment, we're eating food from better soil, we're breathing better air, that then hopefully will give us less complex needs going forwards and less strain on the sector that's already crumbling.
We found in the hospital that people, and it'll sound awful, but the doctors spent more time with us when they knew that my dad was a member of Wimbledon and that had served his country and played internationally. They didn't just see him as Peter, who was an elderly man in a bed. And I thought, oh gosh, how lucky is Dad that he's got us as his family around him to say he may look old and frail, but actually I've never beaten him on a tennis court in my life. And that sort of really sort of pepped them up. And I thought, his care is improving because they know the person this is. And because he's non-verbal, he's not able to, and nor would he show off about it, but I'm super proud, I would say it. But his care improved once they knew the type of person he was. So if there's a way to understand that and find that out from somebody that's non-verbal, through family, through friends, through their doctor or their GP, please, please, please find out more about the person, because then you know you're treating an individual. You're not just treating patient in bed 5 or whatever it might be.
So one of the biggest things we've done around that is started to have different user groups for different customer sets. So the NHS user group was started by our NHS customers a few years ago, and we've kind of merged with them and grown with them and created this forum where we meet regularly. We've got our Christmas lunch coming up this week. Can I say that? Yeah. Is it the wrong time of year for a broadcast? But we've got a kind of lunch coming up this week. We've got monthly meetings, different workshops that happen all around things that are specific to the NHS users. So we decided at the beginning of this year to then replicate that for other user types. So we've got care user groups, we meet, we have regular monthly meetings, face-to-face meetings. We have a hospice user group now, an ambulance user group. We're going to look throughout 2025 to start to diversify that more and keep that principle. If it's something that unites customers, we'll do it en masse, or if it requires nuance, then we do something specific for that market. And our biggest aim next year is to get all these different user groups together and get all of our customers from across the globe in the room together, seeing the amazing work that they do with each other.
I would say my biggest one, being somebody who has worked in digital, now working back in a pure clinical leadership role, don't be scared that other people know more than you do. I think sometimes when you get into a leadership position, you think that you have to personally know all of the answers. You don't, you can't. And so it does come back to the collaboration point. You've got to work with those people around you, but don't be scared. People sometimes, I think, particularly with technology, are fearful because if they say, I don't understand that, they think that is makes them less able to be a good leader. It doesn't at all. The best leaders are the ones that say, I don't quite understand that. Can you help me to understand it? So I would say, yeah, don't be scared that others know more than you. Embrace opportunities, embrace change, be curious. That's absolutely something that I think is my mantra. And just, talk to people. I love talk. You've probably already realised. I'm sure all of your listeners have also realised that I like talking. And, I think it's a really great way of us understanding more about each other, but also understanding more about our patients and how we can make care better for them.
Don't be scared. Make it fun. And just start with measuring at base level before you get started, because then you'll go back and go, but we've done all this good stuff, but you never got the first measurement. To get those first measurements and just try and make it fun. Introduce one thing. You've not got to do all things, and get everyone on board, everyone's input. We're thinking about doing these things. We've got these 3 things we're thinking. You've come back to us and we've said this and you've said that, and get everybody involved.
We worked with yourselves to create our bespoke dashboards. And I met with several companies that had already used them, and they'd very much got IT teams that were going to create these dashboards for them. And at that point, we didn't have that. I was leading on the project. I'm a nurse. My team were nurses, and working very closely with Mark Fuster. Because there was sweat and tears went into creating these bespoke dashboards. We kept saying, but we're just nurses. We're not, yes, we can use IT, but we're not that sort of IT savvy. But the Radar team really, really helped us to build those dashboards. And I think at the end of that, we were really pleased with what we'd created.
I think CQC have almost by accident turbocharged the tech adoption. So not necessarily on purpose. I mean, maybe they have, and it's kind of like an evil genius plan they had. But because they are doing these remote inspections, just to make it clear, they are still turning up in person, but a lot of services are sending evidence documents, sometimes 4, 5, 6 weeks after the inspection. This is a good thing because it means that the inspector is not spending the whole day flipping through folders and you're having to have a panic attack while you try and log into so-and-so's domain because that's who's got all the documents. It's made things a lot easier. And actually, a lot of services have said, in some ways, CQC inspections are a bit less stressful because the inspector isn't having to do everything. I mean, imagine trying to assess a whole service in a day or 2. So the inspectors are slightly calmer because they haven't got the whole weight of everything. But what this has meant is that the way you bring those documents to CQC now is digital. So the days of the big old ring bind folder, it literally, unless you have someone scanning everything, it's not going to work. So CQC, almost by accident, by having these remote inspectors that assess the documents, they have made everyone move to digital. So I think for an absolute fundamental, unless you have a really great team of scanners, you cannot send evidence to CQC without it being on a screen because the inspector is not there to flick through your folder. You need to get it onto the remote inspector screen. That's the first thing they've kind of forced, is the kind of the need for everything to be digitally available. But I think the other thing that we're seeing is that as a result of this kind of move towards digital, it's helping services to think through, okay, how can I group and label this evidence? How can I organize it? And what a lot of services, they're using things like OneDrive and Teams with other things, because they're sitting there going, okay, we've got all of these documents and all these different platforms. We need to centralize it so that we can then share that information. So I think tech is really helping people to think through, okay, what have we got? Where is it? How can we organize it? And I think also as well, people are realizing that using this tech well is a greater evidence than just them saying, we think we do this well. So I think a lot of the monitoring tools within a lot of these tech products is enabling services to have more confidence and put kind of a stronger foot forward around where they are at in some of these different areas. So I think it's enforcing that need to have things available digitally. It's about the organisation, the labelling, and it's about having that higher confidence that what we are doing really is meeting the standards. I think something that tech platforms need to be really savvy on, and I think maybe a few years ago they were less so, because tech platforms like, we've got you forever. So we won't let you export your data because then you'll always have to use us. I think what tech platforms have recognised, particularly with the framework and with the way care is going, it's not so much about interoperability yet, because that's a whole minefield for now, but at least being able to get stuff out of your system is vital. Because at the end of the day, if you have got a remote inspector, you don't want to send them 14 different logins.
Yeah.
You want to be able to go, here's what we've pulled off of this platform, here's what we've pulled off of that platform, here's that piece of evidence, here's that piece of evidence. So I think making sure that your tech platforms can export their data in ways that are universal. So not kind of a weird, funky file type, but an Excel or a PDF or a Word or a PowerPoint. I think that's something that a lot of tech platforms have got their head around and gone, oh, okay, we can't just be insular and keep ourselves, you have to log in to see it. We have to be able to export this, because CQC are not coming in and standing over your shoulder and using the computer anymore. They are sitting, in Northampton somewhere behind an email waiting for you to email that through to us.
Yeah. So at this point, we normally get a story about something weird, inspiring, emotional, something that's happened to you in your career within health and social care that you would want to share with our listeners.
Well, do you know, one of the things, and it really involves technology, I went to a care service and I saw a man who had been to hospital with UTIs 5 times in 6 months. And then a very cheap bit of technology, a Fitbit, was fitted to this man. And it identified slight changes in activity patterns and slight changes in body temperature were a prelude to UTI. They had a prescribing nurse in that service who then prescribed a drug. So this man never had a hospital admission for the last 11 months of his life. What was really, really powerful, though, was talking to his daughter about how much his life had been improved and how much her life had been improved by taking away the worry that her father was always going to be going in and out of hospital. There was also, of course, the benefit that that really had an impact on the system generally. It was good for him, it was good for the care provider, it was good for the NHS. And that was about technology transforming somebody's life. And the important bit for me, though, was talking to his daughter. And I suddenly saw, because I'd seen this from the perspective of saying, oh, it's great, no hospital admissions. Oh, it's great, members of staff didn't have to go to hospital. But actually, it was great for him and it was great for his daughter. And that reminded me that I needed to refocus my priorities and put the people who use services absolutely at the start of the conversation rather than at the end of it.
I think that's so important and something we need to take back. I think at Radar Healthcare as well, it's, we're saying about tech and we talk about the people who are going to use it, but it's the people who are going to benefit from it. I think we need to keep at the heart of what we're doing.
Thanks for tuning in this week, and big thank you to all our listeners. Please don't forget to rate and subscribe. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com. We'll be back with a bang in early September, bringing you more insights into health and social care. So we'll see you then.